Good afternoon, everyone. Can I start by once again thanking all of those in our community who are abiding by the rules and in doing so protecting all of us in the wider community. Let's not forget, we are in the midst of a worldwide health emergency. We are still facing a global pandemic. Global pandemic. Those are alarming words, used routinely now in the same breath on a daily basis. But they are true words. COVID-19 remains an imminent threat to life, and we must continue to do everything possible to keep ourselves and others safe. We do this by breaking the chain of the infection through staying at home, observing social isolation rules, only making essential journeys, and taking one period of exercise each day. As part of our continued response to the virus, here in our Ireland community, the Lieutenant Governor yesterday signed a new proclamation extending the state of emergency in the Isle of Man to the 15th of May. On to today's latest figures. The total number of tests undertaken to date are 2,316. Of those, we have had back 2,172, so have 144 outstanding. The total number of confirmed cases stands at 284, meaning there's been 26 new cases today. Our presumed recovered stands at 154, leaving us with 126 active cases. Since I last stood at this podium the other day, another 2 members of our community have lost their struggle against this dreadful disease. One of those who lost their heroic struggle against COVID-19 was Brendan Maxwell. Brendan was a taxi driver on the island for nearly 40 years. All that knew and met him loved him and his wonderful warm personality. He will be remembered by his family as a wonderful husband and father to his 4 children, of his wonderful husband and father to his 4 children, and a much-loved granddad to his 2 grandchildren, and he will be deeply missed by all his family and friends. Having spoken to the family, the best way we can honour the memory of Brendan and all those who have lost their lives is to continue our fight as a united community against this disease, and no matter how difficult it may be, by continuing to follow the medical advice. As our 21-day lockdown period is extended for another week until the 23rd of April, we pass a landmark of sorts. I should make it clear that all restrictions over the past 3 weeks remain in place, but it is a good moment to reflect on what's been achieved across the board. Our health and care services have adapted, prepared, and are coping brilliantly with the most extraordinary challenges. There have been remarkable public understanding of and compliance with the restrictions we have placed on individual freedom, on families, businesses, and communities. Innovation, adaptation, flexibility, resilience. We've seen these qualities displayed every day in a myriad of situations. We have all had to dig into our reserves of tolerance and patience. It is a very trying time, but to see such a huge collective effort being undertaken in good spirit is so heartening. Thank you to everyone for being part of it. We knew from the start that this is a long game. Tolerance and patience have rarely been such essential virtues for daily life. That is especially the case for returning residents. The first group of Manx residents who were stranded in the UK or abroad when the borders closed returned last night. There has been a great deal of interest in this process, which is understandable as we've never attempted anything quite like this before. I have made it clear there has to be, and continue to be, strict medically led guidelines around this. We have a strong, compassionate will to help our citizens come home, but that has to be guided by clinical advice and tempered by what is doable logistically. That is why we cannot bring everyone home in one go, and why we need to look to do so in a clinically controlled way. We all look forward to a time when the borders will open, and life gets back to normal. But let's be clear about what that will take. Without mandatory quarantine in a controlled area for Isle of Man residents wishing to return home, the clinical body advising the government can't support the borders reopening. I'm joined today by the Director of Public Health, and when we get to questions, I'm sure some of the journalists will want to expand on why it is so important at this stage in preventing infection spread, and how a small number of people would cause a spike in cases which our health service will struggle to cope with. Returning residents have been provided with detailed information about their quarantine arrangements, and we have tried to address a wide range of potential queries. Among these have been, can family and friends bring packages to me in the Comas Hotel, and can takeaway food be delivered? The answer to these questions is no, and this is to maintain the integrity of the quarantine period. I know that the measures we are taking bring with them anxiety, heartache and pain, but the pathway for all returning residents is crystal clear, and there can be no exemptions if we are to ensure the safety of our community for both returning residents and our wider island community. As I mentioned, I'm delighted to be joined this afternoon by the Director of Public Health, Henrietta Ewart, and I will now turn to questions from the press. And first up, we've got Amanda from Jeff the Mongoose. Good afternoon, yes, Amanda.
Good afternoon. Thank you very much, Minister. We've seen a relatively large increase in cases today. Although the number depends on how many results we receive from the labs, we think some members of the public find it demoralising that the number continues to rise despite their best efforts, although we know this is a path of the curve. Could you give us an explanation as to how people are still catching the virus? Are the majority of these new cases, besides household transmission, key workers, people who've been flouting the guidance, or those who are only going out for weekly food shops?
Well, before I bring in the Director of Public Health, Amanda, can I just say, I've said at press briefings before, there will always be peaks and troughs on this journey. As much as we might like the whole thing to look like a smooth curve along a graph, reality doesn't allow for that in real life. You will see peaks and troughs. We will see some days where the cases spike, some days where the cases are relatively low. What matters is the overall average of our whole journey across the curve. So, for instance, we've, just as you mentioned today, we've seen 26 new cases. A few days ago, we saw only 2. So there will be peaks and troughs, and it's important that people don't just focus on the single individual daily figure. They look at the long-term picture of where we are, and that green line that we keep seeing on the graph that keeps being shown to people, because that is the key, where that green line is going longer term, not what the individual figures are day to day. But I'll bring Henrietta in.
Yes, I absolutely agree with what the Minister's just said. It's also important to bear in mind that cases that are being diagnosed as positive today reflect infection that will have happened any time over the last 14 days because of the incubation period. In terms of how it's happening, is it in particular groups? Is it in people who've been in particular workplaces, in particular households? That is beginning to be understood and emerged through the contact tracing process, which is now being set up with data support that will show that. And once we're aware of where those little clusters and outbreaks are happening, we will be much better able to manage them and control them so that they don't spread further.
Sorry, so just to clarify a little bit there, so there's not too much knowledge right now about this transmission. The types of people, we don't really know too much about that.
We know how many are healthcare workers, and that's published in the daily statistics. Of course, that doesn't tell you whether the cases in that group are related to each other or whether they all came by them by different routes, which is actually more usually the case. The other major route of transmission is obviously within households, as you would expect. If one person in a household group gets it, there is a likelihood that they will pass it on to others, and we are seeing that in the statistics.
Thank you very much. And for my second question, tonight the island will rightly clap for its amazing NHS staff as they pull out all the stops to keep us safe during this pandemic. Obviously, we're dealing with more immediate issues, but is consideration being given to a long-term peer review for frontline nursing staff?
So in terms of nursing staff, obviously we are looking at potential peer reviews into the future, but at the moment we are focused on the day-to-day of fighting this virus, and that is the absolutely key thing. Obviously, there will be things that come afterwards, but at the moment the focus is purely on the ground in fighting the virus. And can I thank everyone across our entire health and social care family across the whole island who has been working exceptionally hard to do just that. They are putting in long hours, long shifts. I know Henrietta's team in public health has been putting in an awful lot of work, particularly around the contact tracing, to ensure that we can break the chain of the virus, and that is what we are focused on at this moment in time.
Thank you.
Okay, next up I have Alex from Manx Radio.
Good afternoon. In relation to the department taking over the running of one of the island's nursing homes, Abbotswood, could you confirm the current number of residents there that have tested positive? How many of them have been transferred out of the home? And following on from that, are the residents there still paying the approximate £1,000 a week to the care home, or does that money now go to the department?
Right, well, the first thing I need to be absolutely clear on, Alex, is we have stepped in, not taken over. Now, it might sound like I'm playing with words, but I'm not. There is a very clear distinction. Their licence has currently been suspended, but they are still the licence holders, and we are simply operating the services. So that is very, very different to us having taken over. We haven't taken over. They continue to own the business and they continue to own the building. In terms of testing, we have done testing across the home. We've had some results back. We are still waiting for some, and I'll be able to give a better picture on that probably tomorrow.
And could you say how many have been transferred out for treatment?
The last time I checked, but the figure might be out of date, which was yesterday, there was 2 that had been transferred out of the home. That was the last figure I had yesterday.
Thank you. My second question, the UK's Health Secretary Matt Hancock has announced new proposals to allow people to be with relatives in care homes who are gravely ill with coronavirus, allowing them the right to say goodbye. Is this something you would introduce here? And if so, do you have enough PPE to meet that extra requirement to make the pledge possible?
Well, the first thing I need to say before I'll bring Henrietta in if she wants to add anything to this is what was announced yesterday in the UK. Late last night I had a look at the new guidance that's been issued. It is in limited circumstances, so it's not a free-for-all for people to be able to come in. There is very, very strict criteria around that. Now, we look across the board at different health and guidance that's put out, but at the end of the day, public health here in the Isle of Man decides what's best for the Isle of Man. We will look at that guidance and decide whether it is appropriate. But as I say, it's not just free-for-all that was announced yesterday by Matt Hancock. There is very, very strict clinical guidance around when it is appropriate. And I'll hand over to Henrietta.
Yes, I absolutely agree. I mean, there are two categories really here. One is people who are nearing end of life and in whom there is no concern that they have COVID. The risk from allowing relatives into that situation is that the relatives can bring COVID into that ward, into that area. So that's about protecting the hospital from the incoming relatives. Then the other side of it is the people who are near end of life who have COVID, and that's about protecting incoming relatives from them, but also protecting any unwitting carriage the relatives may also bring. So in terms of risk assessment, this really is very complex, and we have to bear that in mind and take that cold, hard look at that, as well as wanting to empathise with the obvious desires of families to be with their loved ones.
Is it something that you're looking at then to help people who are concerned that relatives might be dying on their own?
Sorry, Alex, we missed the start of that.
Sorry, is it something that you are reviewing then? So that there is a lot of concern we're hearing from people that their relatives are dying on their own.
We review all guidance. We constantly are looking at our guidance. I think I've been at pains at almost every press conference I've done, and there's quite a few now, that we keep all of our guidance under review constantly. And so we are looking at what's come out of the UK yesterday. We also are looking at what other jurisdictions as well are doing. We're not just wedded to the UK. And then we will make a decision here in the Isle of Man as to what is appropriate for our community.
Thank you.
Okay, next up I have Leanne from 3FM.
Good afternoon, Minister. My first question, I wondered if you could provide any clarity on inconclusive test results We've had a few people get in touch wondering if any more information could be given if they receive an inconclusive result after being tested.
I'll let Henrietta come in first from the medical side of things.
Okay, now this is the issue of whether you can get a test which comes back negative, but the patient may actually still have COVID. And this arises because of the nature of the test and the nature of the time course for COVID infection. The test, which is known as a PCR test, is actually very, very accurate. If virus DNA is present, the PCR, virus RNA, I should say, is present, the PCR test will pick it up. The problem arises that if the test is done very early in the infection, there may not be virus shedding, and therefore the virus isn't on the swab. So that's how you get the false negatives. Now, in an ideal world where there is absolutely no shortage whatsoever of swabs, of reagents to do the testing, of lab capacity, or indeed nurse capacity to do the swabbing, then we would say that for everybody, if you've got symptoms that make you a possible case of COVID, you should have one swab. If that comes back negative, you should be swabbed again 24 to 48 hours later. If that's also negative, you're a confirmed negative. If it's positive at that stage, you're a confirmed positive. Now, people will probably be aware that over the course of things, there have been big issues about lab capacity and reagent capacity. And there still is that issue, particularly globally in terms of reagents to do these tests. So although in an ideal world it would be great to give everybody who is an initial negative a second test to follow up and confirm, we actually logistically cannot do that at the moment. We are looking at doing that for certain specific groups, particularly around frontline key workers, and that's a piece of work that we're working to get operationally deliverable. But for people who don't fall in that group, we still do have to say that if you have been confirmed by the 111 line as having symptoms that clinically look like COVID, then even if you have that negative test, you need to do the self-isolation because you are still at risk that you could have it and be transmitting it to others.
Well, Henrietta's just taken all of my points there. In fact, the key one I was going to make was that very final point that even if it comes back as a negative test, people are still told to self-isolate for the 14 days because there is always the risk of false negatives coming through. So that is the key message that comes from this. Leanne, have you got a second question?
Yeah, and my second question, how regular will the next few sailings be for residents who are returning to the island? And do you still think 8 weeks is a realistic target for getting everyone back?
So at the moment, the sailings are weekly. I think it is realistic. Now, the reason being that we've extended it out to 8 weeks that we think it's going to take is actually not due to the amount of people in the UK. It's the amount of people further afield. So a lot of the people who've got in touch with us are still stranded in Australia, New Zealand, Canada. So they've got to get themselves back to the UK before we can really assist them. And that can, in some cases, I'm aware of one constituent where that's going to take at least another 6 weeks for them to be able to get back. Those that are in the UK and meet the criteria, we should be able to repatriate in a fairly quick way. But as I said, the important thing to emphasise is it has to be done in a clinically controlled way. I said in my opening remarks, I am under no illusions that this is going to cause heartache, upset, pain to people, and nervousness and worry for their relatives as well, for people who've been stranded abroad through no fault of their own. But if we are going to protect our island community and stop a second potential wave of infection coming into the island, which would change our trajectory on the way we're going with this virus, then it has to be done in a proper clinically managed way. And I don't know if Henrietta, if you want to add anything on that.
Only to say that I fully agree with what you've just said and don't really have anything to add. Unless anyone wants to pick up with any questions further on that.
Okay, I move on next to Paul, MTTV.
Hello, Minister.
Afternoon, Paul.
Disappointing with that big spike today. Is that to do with this nursing home in particular? And what are we now? Where, I mean, this comes up obviously a few times, but where are we now with other nursing homes? Because the UK is now saying it's massively underreported. This virus is going around and not coming back on official figures. Your take on that?
Well, firstly, I've got to say our testing regime has been very different to the UK. The UK stopped community testing effectively and went to testing just people who were hospital admissions. We've continued with our community testing. Also, we are now looking, as I think was explained at a previous press briefing, in fact, the last time I was here with Catherine 2 days ago, it was, that we are actually reassessing our testing regime. We're looking at doing testing around key workers. We're looking at the testing around care homes. There was a new regime announced in the UK yesterday around care homes, but the important thing to emphasise is they are still saying the only people they will test are those that actually have symptoms. They are not at the moment saying they're going to do widespread testing across people who aren't displaying symptoms. But we are looking at our entire testing around nursing homes. In terms of peaks and troughs, I mentioned before, people shouldn't be fixated by the numbers of cases on one particular day. What people need to look at is the overall trend data that is available on the website. It's the green line on that graph, and that shows our trajectory of travel. Like I said, in an ideal world, we would see everything as a lovely smooth curve that we just follow along, but in the real world that doesn't happen. So there will be peaks and troughs, and we need to get away from a fascination and fixation around what one day's figures are and look at what the trend data is over a longer period of time. And I don't know if, Henrietta, do you want to...
Are you worried about the underreporting, I guess, is probably my question there. Do you think we are underreporting our numbers?
I mean, I to be honest, I think unless you tested every single person in a jurisdiction, there's always going to be some level of underreporting in every jurisdiction around the world. We are actually, if you look at the figures today, it's quite interesting that I was speaking to some officers earlier, and if you actually compare it, we are the 9th best jurisdiction now in the world for testing. Now, as a small island in the middle of the Irish Sea, I think that's absolutely phenomenal that we've actually managed to get to that position. I don't know if Henrietta wants to come in at all.
Yes, I think we've gone exactly the right route for the testing, and I think our focus on testing and then contact tracing and following the lines of transmission down is absolutely right and will become more and more important as things go on. I think one of the important things is understanding the limitations of testing at the moment. The only test that is validated around coronavirus at the moment is the PCR test. That measures virus that is being actively shed when the test is done. So it answers the question, is this person infected now? It doesn't tell you whether they were infected in the past. That's what we really need to have to understand what the pattern of spread has been like in our community and how many in our community have been infected. But at the minute, the antigen tests, which is what we would need to do this to actually test whether people have got antibodies to the virus, none of them have been shown to work. There is a lot of work going on with various manufacturers and trying to validate that test, both through MHRA, Public Health England in the UK, the FDA in America, and none of those tests have stood up to scrutiny. And that's really important to understand because, as Professor Whitty, the CMO across, has said a number of times, the only thing worse than no test is a bad test. So we don't want to go down there. So coming back to the point about nursing homes, what we need to do is have a real good early identification system for suspect cases. So any nursing home residents or indeed staff who have symptoms that could be COVID, we need to have them identified to us as soon as possible and get them tested. But at the minute, the utility of doing PCR testing on nursing homes where there are no people with symptoms is really not shown because, you know, if we find that there are no cases there today, well, that's all that tells us. It doesn't then tell us, well, should we test again tomorrow and the next day and the next day, which actually is logistically impossible. So, what we really rely on is the very early identification and flagging to us of people who may have symptoms.
And just to again come back to the Abbotswood example where cases have been identified, we have gone in and we have basically tested the entire home.
Okay, well, we're going to have this big day on Monday when we get our own testing system put in. Obviously, that leads to the point that you can have more tests. Have you got an ideal amount you want to raise it to? And you obviously keep your eyes on the Channel Islands where Jersey has decided they're going to test everybody, maybe with a kit that hasn't yet been signed off. But what's your approach going to be once we can test here?
Well, Paul, just in relation to Jersey, you're talking about the antibody test, which Henrietta was just referring to. That seems to have gone quiet again now. I'm not sure if Jersey is now going to go down that route after what the UK was going to go down that route as well, until they did the testing around that. And many of those tests that came back, I believe it was less than a 30% accuracy during their trials, which from a clinical point of view is completely unacceptable. And that is, so I don't think Jersey's now going down that route, because that was the test they were planning to do for absolutely everyone. So what's important to remember is, in terms of the testing, the facility we hope will be up and running on Monday. As Catherine said, that is due to final checks being done tomorrow, which will then allow us, if they come off okay, to open the testing centre on Monday. And our capacity then, we expect to be round about the 200 mark per day in terms of testing. So
there will be no waiting list then, presumably, eventually?
Well, as I think Catherine mentioned when she appeared with me at the press conference the other day, we are already starting to see a drop-off in terms of the numbers going through 111 and community testing, and that is allowing us to repurpose our testing around key workers and other things that we want to do in the community. But like I say, I think one of the key messages, which I just put out there before, is we're a small island in the middle of the Irish Sea, and we're the 9th best in the world in terms of testing. So we really are taking on board that message that has been put out time and time again by the World Health Organization, that it's all test, and trace. That's the key to this virus.
You can actually test in a day once it's up and running. Was that one of those things you'll have to wait and find out?
So, like I say, 200 I would expect, because you've still got to have all the swabs spun, etc., and be processed through. So we'd expect our max capacity to be 200.
You've got all the equipment?
We have got the equipment on site. We have had a lot of logistical support around that. And like I say, the final tests are now being done so that we can set everything to live, assuming those tests come back properly on Monday. OK, next we have Josh from ITV.
Thank you, Minister. You said previously that the process to decide who is chosen to come back to the island is random. I've had an individual contacted me saying he's travelled back to the UK from his holiday. He just missed the boat. He's staying with his mother, but is now ineligible to travel back to the island because he's staying with family. Can you clarify if that's now the rules, and how random is this process on who is prioritised to come back to the island?
If we get more applicants than there is spaces on the boat, then it will be done by a draw. I should emphasise, on the first sailing of the people who were in a position to travel back, there was 29 on the boat, and I believe the maximum capacity could have been 33, but of the people who completed the form to the deadline of that sailing, there was the 29. That individual, the regulations were unanimously amended in Tynwald on Tuesday to remove the piece about staying with relatives. So that person, assuming that is the sole reason and the sole criteria as to why they couldn't travel, would now actually meet the criteria. So I would suggest they get back in touch with the Cabinet Office around travelling. So although the draw is random, there is still a criteria people have to meet. That is not having left the island after the border closure was put in place. That is passing the health check, obviously, that is going to be done before they travel. And it is about ensuring that they're fit to travel.
Okay, thank you. And my second question, there still seems to be some confusion with protected masks as new information comes out. Although we've been told they can't 100% guarantee protection, are they still better than having no mask? I appreciate it depends on the mask itself, but generally wouldn't it be better to cover your mouth at all times if you're going out, given we see many workers out doing their jobs wearing them when you go out and about?
Well, one of the things that's very important is that we make sure that masks don't in themselves become a spread of infection. People need to know how to apply and remove masks correctly. There's been studies done around the world that have shown that they don't really have that much effect unless it's someone who's already diagnosed with COVID-19 or it's someone who's caring for someone with COVID-19. Droplets can get caught in the mask, either from the person wearing it or if they've picked it up from somewhere else. If they then touch that mask, they've got it on their hands and they may transfer it elsewhere. The mantra we have had here in the Isle of Man has been around catch it, bin it, kill it. If people start using masks, such as reusable masks, particularly homemade ones, and they are not cleaning them properly, the infection is spreading, then actually our mantra would turn to basically being catch it where it spread it, if people aren't using masks correctly. But one of the interesting things is different countries around the world have taken different stances on this. But certainly one of the most interesting ones I found was Japan. Because Japan has and a lot of the Asian countries have a long history of wearing masks in their community, mainly around pollution. But actually the advice I found last night in relation to masks from the Public Health Authority in Japan is basically that they advise you should only wear a mask if you have symptoms. The effectiveness of wearing a face mask to protect yourself from contracting COVID-19 is very limited. And if you're in an open air or large space environment, the use of a face mask is not effective. So, and that is actually from a country where they have a tradition of people wearing masks in public. Personally, I would, if we were going to mandate the wearing of masks, I would want to see the medical science behind that before we went down that route. But I'll bring Henrietta in.
Yes, absolutely agree with what Mr. just said there. There have been several extensive evidence reviews into the use of masks published just in the last week by the World Health Organization, by the US Centre for Disease Control and European Centre for Disease Control. And the evidence that wearing a mask, either a medical grade mask or a simple face covering type mask, can protect the wearer from infection simply is not there. There is absolutely inadequate evidence to support the hypothesis that wearing a mask will protect the wearer from infection from others. There is a very small amount of evidence from studies around transmission of influenza virus that indicates that wearing masks, including simple face coverings made of cloth, textile, paper, etc., can potentially protect others from unwitting transmission by the mask wearer. And that is quite important in the COVID situation because there is increasing evidence that people can spread the virus even if they have no symptoms. Some people we know can have the virus and never have symptoms, never have the actual disease. Others may have the virus and be pre-symptomatic for a few days before they actually develop the symptoms. So actually wearing a simple face covering, not a medically standardised mask, can protect others from unwitting spread by us. And that is something that we're looking at as to whether we should provide some guidance around that.
So just generally, really, would you say that at this point it is better to wear masks now than not to wear them, I guess?
I think we have to be very clear why we're doing it. As an individual, a decision to wear a mask is actually an altruistic one. It's not about protecting yourself. It's about saying, hey, I might have the virus. I need to protect others. So you might think, yes, I will wear a simple face covering, and there are plenty of sites on the internet where you can find out how to make one of those or buy one commercially. And you might think, I want to wear this when I go to crowded places where social distancing may be difficult. So that might be the obvious one being the supermarket. As the Minister said, if you're in a wide open space, it's not going to protect others, and it certainly isn't going to protect you. So, the context is important. As the Minister also said, what is extremely important here is that people don't regard masks as a kind of guarantee of security, either of themselves or others. And there is a high risk of unintended consequence here if people do not use the masks, including putting them on and taking them off appropriately, because they can transmit virus to their hands, they can touch their face and actually spread it to themselves that way or to others via contact. So using a mask in no way replaces the standard infection control procedures that we should all be following all the time, which is around frequent hand washing, respiratory etiquette, the use of a tissue or coughing into our elbow, and maintaining social distance.
Thanks very much.
Okay, next up I have Chris from Energy FM.
Good afternoon, Minister. Logistics experts from the Ministry of Defence were over yesterday meeting with senior officials. In terms of what was said, how much are you able to reveal?
They were over giving logistical advice. It included around our testing centre. It included around the various work we're doing across the department. At the moment, I'm limited in what I can say. I'm not going to verbatim and go into all the conversations that were had. But in terms of logistics, it was a general logistical visit to actually help us with what we were planning going forward. So around the build at Newlands, around the testing centre, and helping us get that up and running. So I do want to thank very much the MOD and the logistical side of things, who have helped us get the equipment moving for the testing centre. We had some equipment that had stalled in the UK, and we had a private individual come forward offering a helicopter to help us with that as well. So we have had outside support to be able to get things up and running.
So it's not signalled any shift in our strategy?
It has signalled no shift in our strategy whatsoever. All of our strategy is always under constant review. I know people are probably sick of hearing me say it and bang on about it, that things change pretty much every day, but there is no fundamental shift in our strategy.
I'd also like to address Dr. Ewart, if I may.
Yeah, of course.
Figures from Wales today show that A&E statistics down on this time last year. What advice can you give to people who may be in pain or may like to see a doctor but feel they don't want to burden the health service during a time when the majority of resources are going towards tackling this deadly virus?
The advice we're giving is that it's actually very important to continue to seek advice and help as you normally would. I think there are two sides to this. One is people feel hesitant about burdening the health service, but the other side of it is that they may feel hesitant about potentially going into an ED department where they might be exposed to virus. So we would want to reassure them that A, if they have a real concern about their health, which is not COVID related, they must still seek help, and also that arrangements are in place to keep the environment safe for people if they need to present to a healthcare facility, which would largely be via ED these days. A particular group that we do have concerns about is parents seeking help for their children. And there we are actually working through the clinical advisory group on developing some advice that we can put out for the public to support them in how they make decisions about what help their children may need if they develop symptoms.
And if I can just add to that, Chris, as well, of course, we've repurposed with the minor injuries unit up at Ramsey Cottage Hospital as well. So people are being redirected up there. So there is actually a point of contact for people to be using there. Nobody should sit there and ignore an ailment if it needs treating. And people should still present. But we are lucky in the fact that we have got Ramsey Cottage Hospital there as an offshoot with the minor injuries unit that is open to the whole island.
Thank you.
Okay, next up I have BBC and Alex.
Good afternoon. Just to expand on some of the earlier questions which focused on the new testing centre, are you able to disclose where that will be, where the swabs will be done there or still at the grandstand, and how it will be staffed?
So the swabbing itself will still be done at the grandstand. We do community swabbing as well. So people who, for whatever reason, can't go through the testing centre, we do go out and do the community swabbing. The microbiological lab will be done up at Nobles with the microbiology team. It's being staffed by, as Catherine said the other day, by the microbiology department. And they have the capacity to be able to do that. And the maximum testing capacity will be 200 odd.
Thank you. And just to expand, actually, just to move away and touch on a slightly more philosophical point, you touched on the necessity for innovation there and how we've seen some amazing innovation in the island's private sector. I was reading today about an app which has been developed in conjunction with the NHS in the UK, which enables users, will enable users to self-diagnose, use Bluetooth to contact trace people who've been near other people. It's been modelled by Oxford University, and they say up to 80% of the population would need to use that for it to be effective. It got me thinking, is the Isle of Man not the ideal place to trial such innovations as these, given that we are such a small jurisdiction?
I'll let Henrietta answer first on that one, and then I'll come in.
Yes, indeed. We're certainly looking at that app, and I think about 3 others, and GTS, the Government Technical Service, is doing that initial assessment actually to look at the validity of that work. I think the key point about it is actually what you touched upon, that actually the population to have that app installed for it to be an actual useful adjunct to the contact tracing service. It doesn't replace the contact tracing service, but obviously it's a really good backup to people's own memories of where they've been and who they've been close to in the days before they became symptomatic. So yes, philosophically, it could be great. There are other places where they have tried this. Singapore is probably the best example. Now, their app only had a 16% uptake in their population. That's a population that is actually very much used to working with quite a lot of government regulation, so they're kind of comfortable with that, probably in a way that we maybe not to quite the same extent here. So even there, they only got a tiny uptake, and really not sufficient to make a huge difference to how efficient they can be on contact tracing. So yes, I think it's definitely one we need to keep a finger on, but it's not going to be the answer to our prayers in terms of making contact tracing, walk in the park.
I do, just following on from that is the absolutely key point, that it's about the uptake. If the uptake isn't large enough, then it doesn't work. But also, there is also, of course, concerns around what data it collects, how that data is stored, in terms of data privacy of people. So all these are all things that have to be examined. So while it sounds great on the face of it, and during the period of this virus worldwide, there's been a lot of things that have come forward that have sounded great on the face of it, like antibody testing and other things. It's important to ensure that it's clinically sound, but also that it's technologically sound in terms of what it's doing with people's data.
Thank you.
And he's waited very patiently till the end. But last up, I have Sam from Isle of Man Newspapers.
Good afternoon, Minister.
Good afternoon, Sam.
Actually, just before we get started there, just have an update on the Chief Minister. How's he doing?
The Chief Minister is fine. He's back to his usual self. He's still got a bit of a cough, but it is gradually subsiding. He's been chairing National Strategy Group and Council of Ministers. He was chairing Council of Ministers most of this morning, in fact. I've spoken to him via phone, and he should be back with us next week.
Wonderful. And I was just concerned about, you said about Newlands. How far off is that being ready?
So Newlands, we would expect next week, is I believe the current plan, to have Newlands up and running. Obviously, we've got to make sure that from an infection control point of view, after all the works are finished, that it meets infection control standards. But my understanding from speaking to the senior officer team is we'd be looking at some point next week. Unless Henrietta knows something different to me.
No, that's my understanding too.
Just as a side note to that, how many people are currently in hospital, both receiving treatment and awaiting results? Do we have those figures?
Yes, I can give you those figures if you bear with me one moment. I have to go to the technology to get this figure. So if you bear with me 1 second, Sam. The most up-to-date figures I have, which is from 3:30 this afternoon, is in terms of the hospital. We have 11 current hospital admissions. So those are people who are COVID positive, and we have 30 awaiting results.
Thank you. And just to Dr. Ewart, please. We've had reports increasingly from local authorities that fly tipping and people not being responsible for their rubbish is becoming more and more prevalent. How concerning is this from a public health matter away from even coronavirus, and how can this actually be resolved besides the continuous warnings that are being given to people?
Yes, I mean, there are a lot of consequences that stem from lockdown in terms of how long people can be persuaded to comply with the recommendations, guidance and all the rest of it. And clearly one of the things that has happened is the restriction on recycling, which means people either store their recycling in their garage or wherever, or the less socially responsible of us may resort to fly tipping. It has to be monitored and dealt with in the way that fly tipping generally is at the moment. I mean, obviously there is the message to get out that we are as a community all in this together, and we need to have a bit of community cohesion and everybody thinking not only what would suit them best, but actually what the consequence of that for other people would be. Fly tipping can be a problem at the best of times. And sadly, you know, those that would be inclined to go that way if they have a problem with their rubbish would be more so inclined in the current situation.
So maybe it was a bit unclear of what I meant to say. It was more in terms of attracting pests and rodents into homes, and from an actual public health point of view, from a safety area where bins are stacking up and people have
to my knowledge, there isn't currently a problem with the routine domestic rubbish collection. It's just the restrictions on the recycling. So there shouldn't be an issue about food waste or other waste piling up.
Okay, Alex from Manx Radio has got another question, and then Paul from MTTV.
A staggered process.
Sorry, Alex, would you start again? You were muted there. We couldn't hear you.
Sorry. The question's regarding the reintegration process, as and when that happens here. In the UK, it's been said that the young, fit and healthy would be the first to be allowed back out, as it were, in a staggered process, with the elderly and more vulnerable last. Is that the same process planned here on the island, and do you have a plan?
Well, I've said all along at all the press conferences, we do things at different stages. We are looking at our exit strategy. We are constantly looking at all our policies. We're not in a position yet to announce anything around that. I'll bring Henrietta in a moment. But we are looking at what we can do, what, for instance, industries we can potentially reopen. But as I have stressed time and time again, it's not going to be a big bang. We're not going to be one day in lockdown, the next day back to normal. This has got to be a staggered process that is clinically driven on a risk basis approach, sector by sector by sector, across our entire economy. And that includes the movements of people around our island as well. But I'll bring Henrietta in.
Yes, I mean, what we're trying to do here is continue to control the spread of the virus. And the reasons for wanting to do that are A, to prevent ill health and death, but B, to prevent overwhelming the capacity of health and care services, and indeed the capacity of other public services and so on to continue to function to support society as it needs to be. Now, so long as we have a position where we have infected individuals and we have individuals who are susceptible to infection, the infection will continue to spread. The question is, how do we restrict that? And we restrict it by restricting the number of interpersonal interactions that people have. If you are in solitary confinement, you would stop the spread completely, but obviously it's impossible for people to live like that. It's not possible for us to maintain the current level of lockdown long term because it's a very difficult burden under which to live for people, and it also means that we are effectively hugely damaging the economy and a lot of social things that go around that, so mental health, emotional well-being, all the risks of lockdown, such as increased risk of domestic abuse, substance misuse, alcohol abuse, and so on. So there are some huge costs to lockdown, apart from the benefit of slowing and controlling the spread of the virus. So what we want to do, having had a real damping down on transmission rates and illness and need for hospital admission from the really heavy approach to lockdown is that we will want to get to a position where we can start lifting restrictions. But as the Minister has rightly said, you can't do that all in once, or we just go right up the peak again, probably even higher than we've already been, because the infection will then spread in an uncontrolled manner. So what we need to do is get to a position where we let off restrictions, we're able to measure what impact that's having, and then if need be, damp down again by increasing restrictions, or if things are still under control, then lift more restrictions, a bit like opening a valve, if you like, but in a way that we can actually monitor what's happening all the time so that we don't lose control and go running up a massive peak again. So it wouldn't be as simple as saying all restrictions are off for people under the age of X or people who don't have conditions X, Y, and Z. It will have to be more nuanced than that. And that might, I think the borders are going to be a long-term issue because we are surrounded by Europe and frankly much of the world where there are much higher rates of virus transmission than here. So as soon as we start letting people come in from elsewhere, that's going to be a real risk. If we keep the borders closed, we can probably be a little bit more opening in what we can take off purely within the island, so long as we're not bringing virus in from outside. Now, if we want to do a border, relax restrictions there as well, we're going to have to be even more careful about how we relax the other things around social distancing and stay at home.
Yeah, just to add to that as well, Alex, one of the other reasons why we need to do it in a managed manner is decisions, say, we take today have a lead-in time before we see the effects of those decisions. Most studies have shown that a decision made today, it's 8 days before you really start seeing the effect of what those decisions and the impact of those. So you could do something today that might look as if it's ticking along fine, but then you end up with a spike because of that about 5, 6, 7 days down the line. So we've got to do things in a measured manner so we can actually see what the impact is as we move along. So Paul and then Amanda from Jeff the Mongoose.
I was really on the same taxi on that one, asking about where we're going to go with these numbers. I mean, obviously, you potentially could get to zero, but it's unlikely. And as long as that goes on, therefore, until there's a vaccine invented, we're going to be at risk, and therefore the borders will have to remain closed. And that's what's just been answered. But there's a lot of people, the hairdressers, the builders, people who have got businesses who are listening to your every word, Minister, desperate, really. I mean, some of the message I'm getting here, who aren't filling into the scheme, they're not getting the support because they are maybe two different businesses, but only one gets the money, but they're employing people through both businesses. Have you got any words of hope for those sort of people?
Well, I have indeed, Paul, and that is why I say we're assessing sector by sector. So the sectors that will come back first will be those that can manage social distancing, those that are deemed the lower clinical risks. That's how it will be done. That's how it will be looked at. And also by doing things in a managed way, it means that we can actually slowly reopen the economy, and we wouldn't have to, and if assume we don't see a spike, we wouldn't have to reverse things, because that's what you don't want to do. If you rush things, and we just went through a big bang and said all of these sectors can now reopen, the risk is if 8 days later we start seeing a spike on that graph of cases and it looking uncontrollable for our health services, we would have to then reverse all that and put people back into the position they are in today. And that is what we don't want to do. We want any decisions we make to be able to be there for the long term and to start progressing through. So although, as I've said at the start, and this doesn't just apply to repatriated residents, I'm fully aware it applies to people on Ireland as well, there has been a lot of heartache, a lot of pain, a lot of concerned people, and people who, let's be frank, have basically lost their livelihoods during lockdown. But in order to ensure they can reopen and they can have confidence that their livelihoods will be there for the longer term, it's important we do this in a managed process. I don't know if Henrietta wants to add anything to that.
Simply to underline everything you've said.
But the borders could remain closed for the year then, potentially, while we still got cases on the Isle of Man. The borders, you're suggesting, should remain closed.
Paul, I'm not going to speculate on how long certain things are going to last. I'm not going to start putting dates of a month, 2 months, 3 months, 6 months. This is completely unprecedented, Paul. You've got to go back really to the Spanish flu pandemic in 1919 to find something that has spread this much around the world and had this much of an impact. So we're talking 101 years, and so society has moved on a lot in those 101 years, along with our worldwide economies. So what we've got to do is ensure that we do things properly, and that's why we have to take the steps, because no one has got a crystal ball. No one can look into that crystal ball and say, well, if we do this, we'll be able to reopen the borders in 6 months. If we do that, we'll be able to reopen them in 8 months. The simple answer is we really just don't know. We've got to take things step by step and see what effect those steps have. Amanda.
Thank you, Minister. There's been a lot of guidance on mental health and the importance of physical exercise, but it seems quite likely that the longer we're not leaving our homes and moving less in our day-to-day lives, especially the vulnerable who are perhaps not leaving at all, we will finish lockdown much less healthy. Is there a plan to tackle this both now and once we return to normal in a bid to reduce pressure on the health service long term?
I'll bring Henrietta in a moment, but simply to say I want to clear up some confusion, actually, and you've given me the perfect opportunity to do so, Amanda. With the Governor's proclamation yesterday to the 15th of May, I've started receiving emails yesterday saying, oh, we're now in lockdown to the 15th of May. That's not correct. The Governor's proclamation is the state of emergency. So the state of emergency under the Emergency Powers Act 1936 requires a proclamation from the Governor, and it only lasts for 1 month. It has to be renewed by the Governor each month to keep the regulations in force. The lockdown is governed by regulations that flow off that, and we have extended that by 1 week to the 23rd of April so that we can assess the data and then see what we can do in that managed process I keep talking about releasing possibly restrictions and bringing certain elements of the economy back into play. So that's the process that is happening on the 23rd. It's not a case that because the Governor's signed the proclamation, it means we're in lockdown to the 15th of May, and I just wanted to clear that up. And I'll bring Henrietta in.
Yes, I mean, we're very aware that the long-term unintended consequences of lockdown for multiple aspects of health and well-being are definitely there. And we have actually just started off a cross-government group to look at all of that, all the implications of it, and to get plans in place for, where possible, prevention, and also then early intervention to look at mitigating that.
Thank you.
Well, thank you very much, and can I thank Henrietta for joining us this afternoon. Thank you very much, Henrietta. And can I also thank the entire public health team for all of the work that they've been doing. I know it's been absolutely phenomenal, the pressure on your entire team, Henrietta. So thank you to you and all of them for everything that you've done during this difficult time. On that note, I would also like to finish today with a special mention for Howard's Heroes. So the first shout out goes to Sharon Sloan O'Keefe from Castletown Post Office. Her cheeky nature and great sense of humour have been making a real difference to her customers and indeed her community. It's also a similar story at Williston Spa, where the staff have been working extra shifts and hours to help the local community up there. So I'd like to take the opportunity to thank everyone working across our retail sector at this very, very difficult time. The second tribute today is to the Villa Marina security team who've been redeployed up at Nobles Hospital. They're helping ensure people are directed to the right place for their needs. Thank you for all the work that you're doing. Zurich International has designed a wellbeing toolkit that is available on their website at zurichinternational.com/IOM employee wellbeing. It's a one-stop shop with a wealth of information around physical health, personal resilience and mental health. I also know that Zurich has been working closely with many local charities to support them and has recently donated £30,000 to the Manx Solidarity Fund. So thank you, Zurich. And lastly, to the Manx Sewing Caring for Safety group, which formed 2 weeks ago from local crafter volunteers and have now made over 700 cloth laundry bags for healthcare workers to use for their personal clothes or shoes when they get to work and change into their uniform. They are being helped by the team at the University College of Isle of Man, who is getting behind the project in their very own scrub hub. In closing, as today is Thursday, please don't forget to make some noise for our healthcare workers who are doing such a fantastic job at 8 p.m. this evening. Thank you very much indeed.